it's me, Mad B, I'm back. I just got back from my port removal surgery, and let me just say it was a whole experience, and there is no way that I would recommend anyone do this under local anesthetic like I did. So you know that I really hate pain and I'm really afraid of needles, which has been made worse with cancer treatment. But I wasn't able to sleep the week leading up to this because I was so anxious. I asked for Ativan, and before that, they would just say, no, you don't need it. But then luckily today, my appointment was scheduled for 11, but they said to get there at 10:45 because you have some prep to do. I ended up getting there at 10:30. I got taken in at 11, but then I didn't actually go into the operating room until about 12. So the nurse was really nice. She went through the pre-surgery questionnaire and everything with me. I told her about my anxiety and she was like, yeah, we'll try and get you something oral to take. I've got to talk to the doctor about it. He was just so busy that you just couldn't find him. And then finally he was like, yeah, sure, maybe some diazepam. And I was like, oh, okay, cool. I've never had it before. And it's a tiny little pill. And they gave it to me, but it did not work. I was jittery and anxious going up to the surgery. I was just kind of waiting to feel sleepy or relaxed, but it just never happened. I lay down on the bed. You don't have to take off your jewelry or your glasses or your shoes or anything, but I mean, lying on a bed, I feel weird about it, so I took off my shoes. Also, I'm Asian. They took down part of my gown so that it was kind of this area exposed. I wasn't wearing any clothes or any shirt or bra. And then they draped me, used that horrible antiseptic that I can't stand the smell of and I can't wait to never smell again. The one where you click it and all the liquid comes out and they just like swab everywhere. And then I also had to ask, because when they put my port in, I had this nub of suture that didn't dissolve. It gets caught on stuff, and when I touch it, it feels weird. So can I please get that removed? And he's like, oh, yeah. And then I said beforehand to the doctor, he's like, do you have any questions? I was like, yeah, look, I'm really, really anxious because my chest drains got stuck after a week. And he's like, yeah, this will be fine. It's only been a year. And I'm like, okay. I hope they don't get stuck. The worst part was probably the local anesthetic. So it's stung going in, but you can just feel it. They have to move it around to lots of different places to numb the whole area, and it hurts so much. The diazepam wasn't working, so I was just super anxious and crying, and they were like, you're doing so great. And I was like, okay. And the nurse was trying to distract me, and it's a rainy day outside today, so she's like, yeah, how's the weather? Yeah, it's pretty cold and rainy, blah blah blah. And I was like, yeah, okay, cool. Then she got hiccups, and that kind of made me laugh. Finally, they got the port out. It was just, I could just hear crunching and strong tugging and scraping, and it was just something you shouldn't ever have to hear. Pretty strong, my body would kind of move. And then to get the little nub out, I had to turn my neck. And then he was trying to get it out, and it was taking a long time. So hopefully he got it all out, because I can't stand it. Then afterwards, yeah, it was done in about 30-40 minutes maybe. Mine took longer because it was stuck in and he had to full cut it out. I didn't get to keep it. I didn't get to see it. They just cleaned everything up and chucked it out. After I was done, the doctor disappeared, but I was still lying on the bed, and I just burst into tears. Can't believe I'm finally done with all of this. It's been like a year and a half. I mean, I still have to do checkups. Sorry. I still have to do checkups and take the exemestane, but other than that, I'm done with active treatment, and I don't know. I think the diazepam kind of messes with my emotions and the lack of sleep, and I'm so glad to be done. Yeah, everyone's like, you should be celebrating, but I mean, it doesn't hurt. It's still numb, and they said to take Panadol, every 4 hours when it starts to hurt. And I can't take off or change the dressing, make sure it stays dry. And they gave me some extra Tegaderms in case I need to replaster. They're not dissolvable stitches. I have to get them taken out in 2 weeks. But yeah, I can't believe I'm done. It's a great feeling. But yeah, that was a pretty it was meant to be a small surgery. They're like, yeah, in and out in half an hour. I got to the hospital at 10:30 and I got home at 1:45. It was a good 4 hours. But you have to stay about half an hour after you come out of surgery just to monitor you. They do your blood pressure. My blood pressure was kind of normal. It was like 103/70-ish, I think. And then the nurse was really nice and she gave me heaps of snacks. So I got a yogurt. She gave me a fruit cup, some water, cheese and crackers, which I know they're cracking down on cheese at the hospital because of the budget. But I was lucky I got cheese. But yeah, I can't believe I'm done. I can't believe my port is finally gone. I mean, I'm so grateful for it because it made infusions so much easier. But this is a huge milestone, and yeah, I guess it's just the flood of emotion. But yeah, 2 weeks. This is what it looks like. Yeah, it looks kind of bloody, doesn't it? But yeah, 2 weeks and then I get to get the stitches out and then hopefully I can just resume normal life from then. I've got to take it easy today. Yeah, that sucks about the diazepam. Lucky I don't have to take it normally for anxiety, but it was a tiny pill. Maybe I needed more than one. I'm not sure. But yeah, I feel so bad. Like, I was such an emotional mess. Yeah, I feel like I should eat something. I don't know. But yeah, I guess stay tuned for post-cancer thriver life things. I feel like I'm proud to say it now. Like, if you like my content, please like and subscribe. Because I really enjoyed, okay, I'm not going to say enjoyed, but I really valued documenting my cancer journey because it was so difficult. And hopefully it helps someone else going through cancer because it's pretty hard. And also I forget stuff because of the chemo brain. That's why I thought I'd do this one straight away before I had a bit of a nap. But yeah, stay tuned.